So I'm going to go over our anesthetic machines. We have, first of all, we have oxygen tanks. There are two different sizes of oxygen tanks, but at the pet stop we have only the large ones that hold the larger volume of oxygen. They are the H tanks as opposed to the E tanks, which are smaller and often attached directly to the anesthetic machine. These are chained to the wall to prevent them from falling. We have an open and close valve. Right now they are open. You always want to make sure they're open when you're using your anesthetic machine, and closed when you're not. We have a tank pressure valve that shows the amount of pressure within the tank. When they're full, it can be at about 2200 psi. Right here you have a pressure reducing valve that reduces the pressure coming out of the tank to about 40 to 50 psi. It then goes through your intermediate oxygen line and enters your oxygen flow meter. The oxygen flow meter further reduces your anesthetic gas pressure or your oxygen gas pressure to about 15 psi. Which is optimal for delivering oxygen to a patient. Right here is the valve to turn this on and off. When you twist it up, it's now delivering oxygen at 1 liter per minute. When you close it, you want to make sure you don't over tighten this. You just want to get it to the 0, otherwise you can ruin the valve. When I have it on, I can press this flush valve, and that will put a large quantity of oxygen into the system quickly. But you only want to use that in short bursts and want to make sure you don't overinflate your reservoir bag. Next, the oxygen then travels through to your vaporizer inlet port, which is right here, and then into your vaporizer when the oxygen is on, or when your flow meter is turned on. That's when you get 15 psi of oxygen flowing through your vaporizer. Our vaporizer uses only isoflurane. You can turn it on to different levels. What happens is the oxygen passes through the vaporizer. We have a liquid isoflurane in here, and then as oxygen passes through, it turns it into a vapor that can be delivered to the patient. So next we have, on the anesthetic machine, we have your outlet port. So this is where your outlet port goes to, this is now carrying fresh anesthetic gas with oxygen to the patient. We have this Y right here that the patient, this would be attached to either a mask or an endotracheal tube, and when the patient inhales, there's a unidirectional valve, which is right here, and oxygen and anesthetic gas enters into the corrugated tubing to your patient. When they exhale, it exits out through the exhalation valve. This exhalation valve then goes through to your carbon dioxide canister, or carbon dioxide absorbing canister. When you've been using the carbon dioxide canister for a while, these granules will change color, and that's based on the pH that changes when carbon dioxide is converted into calcium carbonate in that system. So the anesthetic gas that has already been breathed by the patient, and their carbon dioxide goes through this system, their carbon dioxide canister. This is in a rebreathing system or a circular system. It passes your pressure manometer, which shows how much pressure is in the system. You don't want this pressure to exceed, well, if it's centimeters of water, you don't want it to exceed, in small patients anyway, that should be 20 centimeters of water. So let's see. So you don't want to exceed the 20. If this was measured in milligrams or millimeters of mercury, you wouldn't want it to exceed 15. With larger patients, you can have it, you don't want it to exceed 40 centimeters of water or 30 millimeters of mercury. But so ours reads in centimeters, and it should be 0 when the patient is breathing. So the anesthetic gases that have already been breathed go out the exhalation valve into your carbon dioxide canister, absorbing canister. We have a date when it was last changed on here, and just want to make sure that once a lot of the granules are turning color, that we make sure we go ahead and change those. It then passes into a reservoir bag. So this is a large 4-liter reservoir bag, I believe. Yes. So this is just acts as a soft reservoir for gases in the breathing system. You basically want a large enough bag that all the gas that a patient would inhale on one inhalation is in there, but not so big that you can't easily monitor the patient's respirations using the bag. You can also monitor respirations with the inhalation valve and the exhalation valve. These keep gas going one way through the circuit. So once it goes into the reservoir bag, you get this gas can be rebreathed by the patient through the inhalation valve. And you can see that here, right here is where the fresh inlet. So they're breathing a combination of already breathed anesthetic gases and fresh anesthetic gases when they're breathing in a rebreathing system. We also have a pop-off valve, and basically what that does when it's fully open, the pop-off valve allows the excess carrier and anesthetic gases to exit the breathing circuit and go to the scavenging system, which we have right here. We use activated charcoal or an F-air canister that absorbs anesthetic gases. When it's closed, none of the gases will be going to that, and you can have pressure build up in the system. So you'll want to monitor your manometer, your pressure manometer, and make sure that doesn't exceed the 20 centimeters of water. So right here is the F-air canister. This is part of the scavenging system. A lot of clinics will have a passive scavenging system that actually the gases will flow just using positive pressure from the anesthetic circuit out through a tube out to the outside. Other clinics will use a active scavenging system that uses a vacuum to suction the waste anesthetic gases out to the outside. So that is basically the anesthetic machine when it's with a rebreathing system. When you attach a non-rebreathing system, which you do for pets under 7 kilograms, it's a little bit different. So right now I'll show how to attach that. So this here attaches to the outlet. This is where